We have another crisis together with COVID, and that is a true mental health crisis. The rates of anxiety and depression, and particularly among youth, have been skyrocketing. Suicide is a very real problem amongst youth today.
There is so much bad in the world right now, and it really affects some of our youngest among us.
Well, I'm a single mom with 3 little ones. We've been through a lot lately. We've spent a lot of time getting kicked out of shelters because of my son's behaviors. It's been brutal.
Young people are struggling, and it comes across in different ways depending on the age and the developmental level of the individual. Crisis response systems are an extremely integral part of behavioral health services because it allows a response team to respond to an individual or a family in a moment of crisis. And it helps alleviate or reduce suicide, hospitalizations, or other extreme traumas to the family.
The WISE Children's Crisis Outreach Response System, or CORS program, is really innovative amongst youth mobile crisis response in the sense that they can actually stay with a child and family longer. I think it's up to 60 days, and that's really significant.
They've been a cornerstone of our behavioral health system. A youth experiencing a crisis is not always connected to resources, so that unconnected youth and their family needs a place to turn, and CORS has consistently been that program. It's been so invaluable to the families and the youth that need the crisis response.
I'd say it had tremendous impact, especially when I felt like I was doing just the worst job as a mom. Like I was just completely failing, and they're like, "No, Mom, you're doing great. Like, you're gonna be okay." And I think that meant more than anything.
We need to make access to treatment a lot easier, because we know that if you get someone in time, the amount of therapy they need is smaller.
The state has made more significant strides in the last year related to behavioral health crisis response than we ever have historically.
We're so glad that the Ballmer Group are stepping up to support the workforce of the mental health field, of the substance use field, so that we can better serve young people throughout Washington State.
We are so fortunate to have the Ballmer Group. First, I would have to say their staff are so talented. They have so much knowledge of the system and how it works. And what I have found is they really come to the table to help us say, how can we do this? Their solutions are creative and get right to the point of the issue.
They have been a leader in the philanthropic community. They have taken risks in many programs, many projects that have demonstrated that there is a different way to do this. There's an innovative way to do this.
You know, I'm a big fan of public-private partnerships. And what I find exciting is that often we can tackle very complex issues. But there's not one solution, right? There's multiple solutions, from housing to behavioral health. There's so many opportunities to really make a difference working together.
I'm really, really excited about what's possible with the slate of investments that the Ballmer Group has made. It has incredible potential for our state.